Hello, my name is Dr. Doug Olson. If you are watching this video, then you have decided to make a big step and a large investment in your future quality of life by having a joint replacement surgery. You've decided that you no longer want the pain and stiffness of arthritis to dictate your quality of life and the type of activities that you enjoy. I have created this video in hopes of providing more information to you and alleviating some of your stress and anxiety about your upcoming joint replacement surgery. You can also share this video with your family members and your caregivers who will be caring for you after surgery. In this video, we will discuss all of the aspects of your upcoming joint replacement surgery, whether it be shoulder replacement, hip replacement, or knee replacement. We will discuss the preoperative evaluation, as well as your hospital stay, your surgery, your post-operative care, and also your recovery once you leave the hospital, and long-term expectations. It is important to remember that every patient's case is specific, and this video is for general informational purposes. Now I'd like to discuss in much more detail your upcoming shoulder replacement surgery. First, it's important to note, and I'm sure that we have talked about this in the office with you, that there are two different types of shoulder replacements. There is what is called an anatomic total shoulder replacement, and that is a shoulder replacement for people who still have a good, intact, functioning rotator cuff tendon. For patients whose rotator cuff tendon is torn or is not functioning well, we perform what is called a reverse shoulder replacement. This is not something necessarily that you need to stress about, but it is important to know that there are two different types of implants to treat two different types of shoulder problems, meaning patients who have arthritis but a good rotator cuff, and patients who have arthritis but a bad rotator cuff. Let's review some x-rays that are representative of what your arthritis may look like, and review those as well as x-rays that are taken after surgery, which show the implant. Here is a representative x-ray of someone with shoulder arthritis that may look similar to yours. We're looking at the shoulder from the front, and what we see here is that there is no space or no cartilage left between the ball and the socket. There's also a large bone spur at the bottom of the ball here. On this x-ray, it is likely that the patient's rotator cuff tendon is intact because we see that the ball is not riding high out of the socket. Typically, we determine that your rotator cuff is intact or not based on your preoperative examination, your x-rays, and also an MRI of the shoulder. Here is another representative x-ray looking at the shoulder from the front. On this x-ray, we see that the ball is riding high out of the socket and even abutting the shoulder blade bone above. This is an example of someone whose rotator cuff is torn and not functioning. For this patient, they would require a reverse total shoulder replacement. Now let's look at an MRI to evaluate the rotator cuff. This is one picture of an MRI taken from a patient's shoulder, looking at the shoulder from the front. Here we see the ball, and here we see the socket. There is bone-on-bone arthritis here, but it's also important to note that this is the rotator cuff tendon, and this shows a large rotator cuff tendon tear. The tendon stops here, and if the tendon was intact, we would see the tendon coming all the way over and inserting on the bone here. Again, for this patient, they would require a reverse total shoulder replacement. If the rotator cuff was intact and working well, the patient would require an anatomic total shoulder replacement. For both types of shoulder replacements, your incision will be on the front of the shoulder. And when I get down into your joint, this is a model which shows after the implants have been put in, but we need to remove your arthritic end of the bone, meaning the arthritic ball from the ball and socket joint, as well as resurface the socket. And we put in a new socket made of medical grade plastic. This gets cemented into place. And then we put in a new ball with a stem on it that go inside the canal of your humerus bone. This recreates your ball and socket joint. This is what we call an anatomic total shoulder replacement for patients who have a good functioning rotator cuff. This is a model of what a reverse total shoulder replacement looks like. Here we see that the ball and socket have been reversed. And again, this is after the implants have been placed. We remove the arthritic ball and resurface the socket, and we place this metal base plate that gets attached to your socket with screws, and then a new ball gets attached to that. A new socket with a stem then get placed down the canal of your humerus bone, and then we put the joint back together. That's what makes up a reverse total shoulder replacement. With whatever shoulder replacement you receive, your stitches are typically all underneath the skin, and the skin is closed with glue typically. A sterile bandage is applied to your incision, and then once you have recovered from the anesthetic, you are taken to the recovery room. I also wanted to mention that if we have determined preoperatively that you are a candidate for the anatomic total shoulder replacement, there is also a very small possibility that in surgery we determine that your rotator cuff is torn more than expected, and we need to proceed with the reverse total shoulder replacement. This is unlikely, but it's important to know this preoperatively. Either way, usually all of these stitches are placed underneath your skin as we are closing your incision, and the skin is glued shut. A sterile bandage is applied, and your anesthesia is reversed, and then you are taken to recovery to recover from the anesthetic. This is a post-operative x-ray looking at the shoulder from the front. For this patient, they underwent an anatomic total shoulder replacement. Again, that is the shoulder replacement chosen for patients who have a good functioning intact rotator cuff. Here we see that a new metal ball has been put in place to replace the arthritic worn out ball. There's a stem that goes down inside the canal of the humerus bone, and a new socket has been put in place. In this case, it is a socket made of medical grade plastic with a metal stem into the bone. This is a post-operative x-ray looking at the shoulder from the front. This is a patient who underwent a reverse total shoulder replacement. The arthritic ball has been removed, and a new ball and socket have been put in place with a stem that comes down inside the canal of the humerus bone. It is called a reverse shoulder replacement because the ball and the socket have been reversed in order to give you as much function as possible. Again, this is for patients who have a deficient or torn rotator cuff. There are a number of things that need to be done prior to surgery in order to prepare you to ensure your best chance of a successful joint replacement surgery. Each of these